Now, here's today's host, Dr. Monika Buerger.
Hello, everybody out there in Chiro Facebook land, and to those of you that are not chiropractors, welcome to Look to the Children show. And again, thank you, ChiroSecure, for giving us this platform to get our message out and to keep educating the amazing chiropractic profession. I wanted to bring to you today something that's very near and dear to my heart and is so incredibly critical that we as professionals in the chiropractic realm really need to understand this material. Whether you look or work with families and children or not, this is information that we are going to be needed to be mindful of from here on out. Given the paradigm that we are practicing in now and what is going on in the world and the COVID epidemic or pandemic, the consequences of what we're experiencing now, in addition to how the world was before this pandemic, the two combined are essentially leading us up to what I'm referring to as the next epidemic. And what I'm talking about is not a specific disease or diagnosis or label. It is the effects of prenatal stress. So again, whether you work with preconception care, prenatal care, pediatrics, if you work with anybody, this information is a must know, and it's extremely, extremely profound. So what I'm going to try to do is take you, I've set up a PowerPoint. You can see my slides. I'm going to take you kind of through a mini course from prenatal stress and what that's going to look like down the road, or what that does look like down the road. This is information that is vast. It's profound from the world of neuroscience. I'm not making this up. I'm not overstating it. I'm not over exaggerating it. And if we look at in the depths of neuroscience, this information that I'm going to talk to you about today is the foundation. It is the basis for the neurobiology of dis-ease. I want you to sit with this. The basis of the neurobiology of dis-ease, physical disease, and especially mental disease, illnesses. So let's dig in a little bit. Again, please pass this information on to all of our colleagues. This is such profound information that is going to set the foundation for generations to come. No joke here. So this paper came out a few weeks ago in regards to prenatal stress and specifically how moms are perceiving stress in this particular time. Look, pretty much probably 99.9% of the global population is experiencing some kind of added stress due to the situation we're in. Stress, anxiety has gone drastically up during this time. What does this mean for the pregnant mom, and what does this mean for the offspring? It's huge. Pregnant moms right now, this came out of, I believe, Alberta, Canada. But what they showed is pregnant moms, the prenatal period and the early weeks postnatally, that their pre-COVID stress levels would be reported about 15%. In the current paradigm, their depression, in regards to depression solely, pre-COVID time, 15%. Current paradigm, about 41%, depression. Anxiety, their prenatal reporting of anxiety is about 29%, and in the current paradigm is about 71%. These are vast jumps in pregnant mamas experience depression and anxiety. Okay. They also looked at, which was very interesting, is exercise rates. Okay, prenatal activity rates, and about 65% of pregnant women report that their exercise levels has gone down during the COVID period. About 15% have said up, and about 21% saying it's been staying stagnant. Okay, what does this mean? Why is it a big deal? Again, this information is hands down how we're going to see generations to come. The program that the prenatal programming that's happening now in utero is vast and profound. We know from the neuroscience literature that when a mama is stressed, the enzyme, the gene that works to as a barrier, protective barrier to the fetus, keeping cortisol out of not being able to pass the placental barrier. That enzyme, it's called hydroxysteroid dehydrogenase 2. Don't worry about the name of it. Bottom line is that enzyme is protective to the fetus, and it doesn't allow more than 15 to 20% of cortisol should not pass the placental barrier. More than that passes a placental barrier, a dynamic cascade of neurophysiological consequences because that fetus is exposed to more cortisol, which is neurotoxic. This is very much associated with preterm birth and low birth weight, with which those two factors in the world of neuroscience has been shown to be key in the neurobiology of disease, lifelong disease of the offspring, especially mental health and a lot of cardiovascular. Okay? So we need to minimize the stress. Bottom line is we need to minimize the stress on those mamas. Low protein levels also will inhibit that enzyme. The enzyme needs good proteins to work. And B3, niacin. My moral of my story for this lecture or for this presentation, I wanted you to understand that how stress is altering fetal development. And one is by cortisol, excess cortisol exposure that is very neurotoxic. So we need to have these mamas under care to help regulate that stress load, which we'll talk about when we finish it at the end of this little presentation. But I want you to understand that prenatal insults, maternal stress is one of the biggest ones. Psychosocial stress. Psychosocial stress is stressors we all have, especially these days, right? Worried about your job, paying the bills, going out in public, just those dynamics. But pregnant mamas have extra psychosocial stressors that they report. That is the fear of giving birth, the concern about being birthed. That is magnified in this particular crisis we're under. Are they going to be allowed to have a birth partner in the room or not? They're having to mask the whole time while they're in the hospital. Are they going to be separated from the baby? All these extra things. The number one psychosocial stressors that pregnant mamas report or pregnant couples report is giving birth to an offspring with developmental challenges. So they have these extra stressors happening, all right? We know that these prenatal stressors are leading to developmental circuit changes in the brain, prefrontal cortex, amygdala, hippocampus, incredibly profound connections, especially between the limbic system and the frontal lobe, which we know from neuroscience, that connection or that misfire, that misconnection between the limbic system and the prefrontal lobes is the basis of mental illness. Okay, this is from the medical literature. And of course, then we get the labels. As a result of this prenatal stress, now we get the labels down the road, ADD, ADHD, autism, etc. So it's really kind of works like this. It used to be referred to as a 2-hit model. Now they're looking at it as a 3-hit model. We have genetic factors, which actually are epigenetic factors. Okay, so we have these epigenetic loads that are vast right now. Hit number 2 is prenatal stressors, psychosocial stressors, depression, anxiety, everything that is up ramped right now globally. The third hit is a subsequent hit that can happen up to 20 years later that finally tips the scales. And this is really the basis of most mental illnesses and individuals in mental institutions. And whether it's a viral load that, especially if mama right now has had COVID while she's pregnant, that is a viral load that fetus is exposed to. So we have stress. It leads to enhanced cortisol passing the placental barrier, neurotoxic insult on the developing fetus and the developing nervous system, other genetic predispositions, and now down the road, another hit can happen. And a hit can be anything. It can be viral, it can be bacterial, it can be from inoculations, it can be poor bonding with mom and dad, whatever. So we know that prenatal stress also alters the microbiome of the mom. I'm just going to brief over this, but this is incredibly, incredibly important for us to understand. For supportive measures for mama during pregnancy. So a couple key strains of bacteria have been known to be altered or deficient in pregnant mamas under stress. And these particular strains are also coincide with supportive measures for key areas of the brain, like the limbic system and the frontal lobe. So moral of the story is stress wipes out the microbiome, wipes out, excuse me, these critical bacteria, which all can alter function of these key areas of the brain. Okay, Lactobacillus rhamnosus and reuteri are two of those strains. Aberrant or deficient microbiome of mom leads to a deficient microbiome of the vaginal microbiome. So, next moral of the story, next golden pearl. It doesn't matter. A lot of people are concerned about seeding of the microbiome or giving probiotics if a baby is born via a cesarean section, because they say, well, baby didn't get a exposure to mom's vaginal microbiome. Hello, newsflash. If microbiome of mom is poor, vaginal microbiome of mom is going to be poor. Whether they were born vaginally or not, they could still have a dysbiotic, the offspring, the baby, can not have a optimal microbiome, even if they're born vaginally. So we may still need to help support that after birth, because we know a dysbiotic, a non-sufficient microbiome will also alter absorption of key nutrients. And these key nutrients are going to be imperative for metabolic functioning, for metabolic demands on the developing brain. So stress equals altered, stress is very much related to preterm birth and low birth weight. Altered microbiome of mom, altered vaginal biome of mom, altered microbiome of baby, lack of absorption of key nutrients needed for metabolic development, metabolic support of the developing brain, key structures of the brain. So we have stress or an infectious load. It alters the maternal microbiome. It alters the microbiome of the baby. It is shown in neuroscience that this will change the trajectory of neurodevelopment of the baby. However, early intervention measures, chiropractic care for sure, especially during the prenatal period, trying to de-escalate the stress load on that pregnant mom. De-escalation of stress on mama is de-escalation of stress on the fetus equals a more optimal chance of neurodevelopment. When we look at fetal development, we have to look at autonomic nervous system development and vagal tone development, which that critical window of neurodevelopment is in the end of the second and into the entire third trimester of birth. Absolutely even more critical weeks 35 and on. What we're seeing in this COVID world is an increase of C-sections, whether that's because of stress or not, an increase around 37 weeks. This is a critical, critical message, because we also know that the microbiome of baby, if delivered, if born before 37 weeks, has a higher chance of what we call this necrolizing enterocolitis, okay? Inflammation in the gut, which is going to be another factor in their neurodevelopmental trajectory. This is vagal tone. So prenatal stress lowers heart rate variability in mom and baby, which this equals aberrant development of the ANS, the autonomic nervous system, and vagal tone. Decreases the function of the cholinergic anti-inflammatory pathway. That is vagus. That's vagal's baby. That's his pathway. Cholinergic, anti-inflammatory. Cholinergic, anti-inflammatory pathway. This is the big kahuna to downregulate inflammation and upregulate the immune system. When this is downregulated, this thing called zonulin that functions, it controls the tight junctions in the gut, not allowing them to stay open and end up with a leaky gut or gut permeability. So you see the picture I'm painting right now? This is incredibly important to understand because this is the basis of neurodevelopment. We also know that heart rate variability, vagal tone on mom, the baby is going to mimic the vagal tone of the mom. Baby is going to be born, it's called fetal programming, with mom's stress response. The way mom is perceiving her environment, perceiving her stress, and adapting, neurally adapting. We all talk in the chiropractic profession about neural adaptation. The nervous system has to adapt to our stressors. The way that mom is perceiving her stress, her environment, and the way she's responding to it will be fetally programmed to that fetus. And that offspring will adopt her stress reactions and her stress patterns. And that will alter their vagal tone, their heart rate variability, and their ability to adapt to stress, their ability to calm, their ability to digest, their ability to be in a learn and grow spurt. So we also know that prenatal stress is very much so tied to neuromuscular development. So it is tied to sensory modulation, how they perceive their world through the 10 sensory systems: sight, smell, sound, touch, taste from the outside world, and our interoceptive inner sensations, which are vestibular, proprioceptive, sensations coming from the viscera, from the immune system, the immune cells, and from the microbiome. So all these can be dysregulated. Aberrant sensory modulation or input to the CNS is going to lead to aberrant neuromuscular output. And neuromuscular output, motor output, will then alter sensory input. It's a loop. But we also see that prenatal stress is very much associated with neuromuscular tone and neuromuscular development in the offspring. Motor tone, motor control, core postural control is associated with things like asthma, allergies, dyslexia, ADHD, scoliosis. So what happens prenatally and how that fetus is pre-programmed by mom's stress response. And mind you, that study I cited that we just got in regards to the COVID crisis, a vast increase in reported depression and anxiety in pregnant mamas. They also reported lower exercise. About 65% reported decrease in their exercise regime. We also know from neuroscience literature that prenatal exercise during the prenatal period enhances a vagal tone in the offspring. So if you look at the entire picture, the dynamic of what's happening right now, we must be mindful, we must be knowledgeable, we must be educated at a little higher level, because what we're going to see downstream, it may be 2 years in these offspring. It may be in 6 months. It may be in their 20s. It may be when they start to go to school and they get slapped with a label of ADHD because they can't sit still because they have poor postural tone. We must understand that what we lay the foundation of as now is going to have a profound effect on generations to come. And we need to be able to recognize these red flags in practice. We look at, so if you have an older child coming in, you should look at the history. When were they born? What time period? What was the prenatal stress exposure? But also be mindful that if you're seeing pregnant women right during this time period, neuroscience research also shows that even if when these stressors have been resolved, they've done a lot of work looking at disasters and the long-term effects on offspring during when moms are experiencing natural disaster, like earthquakes, like even the Holocaust. Like one big one is called Project Ice Storm. It was regarding an ice storm up in Canada and the prenatal stress on mamas then. 9/11. All these hallmark disasters, floods, they looked at the implications on the offspring. And they all show a post-traumatic stress disorder response, higher anxiety, higher depression levels, increased risk of cardiovascular disease. Even if the mom conceived 2 years after that disaster had dissipated. So my message to you is we need to be mindful of the potential that we're going to see down the road. Prenatal stress, a higher risk of preterm births or assisted births. I'm getting pinged on social media all the time about increased risk of breech presentations. That's going to happen. Breech presentations there's a tie between thyroid dysfunction in the mom and a breech presentation. When mom is under all the stress and the adrenals are compromised, it's going to compromise the thyroid. You can't stabilize the thyroid unless you stabilize adrenal function. So it stands to reason we're going to see more of these breech presentations. Plus, mom is much more physiologically stressed out, much more tense. So we may see more assisted birth, more cesarean section, which we're tending to see babies being delivered during this COVID time. More assisted deliveries, maybe. I have not seen that statistic yet in regards to suction or forceps, but these all play a huge role in the trajectory of neural development down the road. We're going to see more. We already before this COVID crisis have seen a vast increase in babies presenting with more agitation, colic, difficulty with feeding, difficulty sleeping. This is the pattern you're going to start seeing more and more of. Then we lead, because their nervous system is so tapped out and their immune system is compromised, they can't neurally adapt, increased in infectious load, higher risk of chance of antibiotics early in life. One dose of antibiotics wipes up the microbiome for life. It alters the microbiome for life. It can never reestablish back to its original microbiome after one dose of antibiotics. We may see hyper or hypo, more chances of hypo muscle tone because of the neuromuscular maladaptive development. More developmental motor delays or developmental delays in general. And this is going to up even more so our rates of labels of autism, ADD, ADHD, oppositional defiant disorder, developmental coordination disorder, whatever label you want to put forth. So my message to you is early intervention. Chiropractic care is going to be incredibly important for pregnant mama and that baby. But remember, they're going to be born into this world already with difficulty in neural adaptation. Less is more for these little fiddle farts. children that are born and they're stressed and they're colicky and they're hard to console and so forth, it's harder to bond. And that leads to uh, a less maturation of the social engagement portion of the vagus. Another story for another time. The microbiome. I understand that many of you may not be comfortable or may not wish to venture in supporting the microbiome, but I can tell you that this is absolutely a critical, key, important point that you need to understand. And if you don't feel comfortable, maybe reach out to a colleague that feels comfortable helping support that microbiome. The adjustment's going to do that. But in this day and age, we need to look bigger and deeper. And then we need to understand how to foster optimal sensory motor development. Get yourself in a program, take classes, but we need to be able to recognize these red flags, because the sooner we can intervene, the better the chances for that little fiddle fart long term. And again, I thank you. You know, we should start thinking about how we're going to articulate our message going forward from a pain-based, to a brain-based model. And hopefully this information helps give you some nuggets to think about and to investigate and to further study and learn and understand, because we are going to need this information and we're going to need to get this out to the world, because this crisis has changed generations to come that have not even been born yet. So I'll leave you sit with that. I have many classes that you can go to, and I have one and one coming soon just on the effects of prenatal stress and what we need to think about. So I'm going to close with that. With that said, again, thank you, ChiroSecure, for being an amazing vehicle for us to get this information out. And more than ever, we are needed to guide the world in hope, in truth, in knowledge, and education of how we can change the trajectory for generations to come. I will see you next month with an incredible, surprised, amazing guest. And you can be with Dr. Eric Kowalski the first Thursday of August. Until then, keep being amazing and keep being out there and changing lives.
Today's pediatric show, Look to the Children, was brought to you by ChiroSecure.